I'm legally blind and not knowing where I'm going it will always create some anxiety. Thankfully, I have two CNI kids that are 8 and 10 years old. Once in a while, one of them will forget and walk me into a tree branch. For the most part, they are great for leading me around town. When my kids were younger, I remember getting a prescription for both of them for $86 each. Of course, I didn't know that it was that expensive or that it wasn't covered under health insurance until we got to the pharmacy. I didn't know what to do as I stood at the counter. The kids were sick, and I wouldn't get another appointment with the doctor for a couple of weeks. We had to do it, but it was a week before my husband's next paycheck, and there wasn't anything left over. When we went home, we went to our bank accounts, the couch cushions, and took all of our bottles into the depot. But after everything, we were still $10 short. Thankfully, they agreed to keep a piece of ID and let us pay the final amount next week. That wasn't the first time that I had problems buying medication. I was diagnosed with fetal alcohol syndrome and anxiety when I was young. Because I was a ward of the court, they paid for the anxiety medication and it worked for many years. But about 4 years ago, it just stopped working. I went to 6 different doctors and was prescribed a few different types of medication. But every time I got to the pharmacy, I found out that they were not covered by AISH or AHS, so I didn't even bother. I would tell them that I didn't have money for expensive medications, but they would always say, "Oh, that's fine." I don't think they knew which ones were covered or how much they cost. Over the years, I've never really talked to my healthcare providers about money. It just never came up in conversation. Until one day, a doctor did ask me about it. We were talking about my anxiety, and he asked me if we had enough money to get by over Christmas. I told him that we should be okay, and we were. When we got a Christmas hamper on our doorstep a month later, we still make it by month to month. We don't have savings, but we do have food and shelter, and our bills are paid, and we are happy. Sometimes the kids don't get the candy they want, but recently I learned how to make gummy bears, so at least they get something.